It's a cost reduction program. I call it a solution provider program. I don't think anymore that companies can go in and just provide a service or a product, get paid, and walk away. I just think those days are over. I think that what you have to look at now is do you have a solution? Here's the solution. As you know, healthcare is in the risk management business. You have to manage your risk. So if I go in, I'm going to give you an opportunity where I will provide my service at no cost to you. I'll provide the services at no cost. Now, what we will do is we will establish what is your cost base in infectious disease for specific areas. For instance, what's your cost of an isolation room? What's the cost for caps, gowns, masks, and gloves? If you have semi-private rooms, how much revenue are you losing on that second bed? And so therefore we establish your cost base. I don't do anything with revenue. It's all about cost reduction. If I know what your cost base is, then I'll take the risk of doing all your testing at no charge, but we'll come to an agreement on what percentage of your savings I'm authorized from you. So it doesn't have any problem. We don't have no problems with the Office of Inspector General because we're not doing a revenue sharing model. I'm only taking the risk with you based upon reducing your cost in infectious disease. What most organizations do is they'll sell you their service on a transaction basis. So, if you want to buy a respiratory test, here's the price. If you want to buy a MRSA test, here's the price. If you want to buy a C. diff test, here's the price. What I'm saying is each one of those patient populations is costing you a lot of money. And I have a solution to that. And mine is because I'm faster, better, and ultimately cheaper. What do I mean by that? I'll lower your cost. So though my test may be more expensive on the front end, I'm cheaper on the back end. And so that's what I'm saying. It's a true solution. It's a solution for identification, and it's a solution for cost reduction. And that's where I think hospitals are at. We've proven that model at a hospital, a 520-bed hospital up in Ohio. And what was interesting is the financial impact of that hospital was a significant number of about $10 million. That was part of it was an enhancement of revenue on the outpatient side that they did, right, because they can rebill. The second was that they had semi-private rooms, so we eliminated 900 beds of isolation. That was all of them. We eliminated all their isolation beds, which means now they had the second bed that they could generate revenue. And then what we did is we calculated what was the cost of their isolation, and then also the cost of the materials, caps, gowns, and gloves, and so on, and came up with a complete algorithm so we know exactly what their cost is and what their cost reduction was. It was over $10 million. The abstracts have already been done, and now we're going into the publications that will be presented at 2 international meetings. And then from there, we're going to take that to new hospitals.